Studying prevention in skin cancer can be really challenging because skin cancer takes decades of exposure. UV exposure is cumulative rather than just being one exposure at one point in time. So we usually measure effectiveness of prevention interventions by looking at the intermediate outcomes. And we have three main outcomes that we usually look at, which are reductions in sunburn, reductions in indoor tanning behavior, or by people using sun protection more, increasing the number of people who are wearing sunscreen or using protective clothing. Based on these outcomes, the Community Guide recommends several interventions. The broadest type of intervention are called multi-component community-wide interventions. And the Community Guide defines those as at least two different types of interventions implemented in two different types of settings. So for example, a school sun safety education program paired with a mass media campaign in a community. The most comprehensive examples of this type of intervention are from Australia. CDC produced a vital signs report that was published in June of this year that estimated that about 21,000 cases of melanoma could be prevented through community prevention programs each year, saving about $250 million. Educational and policy interventions have been demonstrated to be effective in schools from early childhood up to 8th grade, as well as in outdoor recreational and occupational settings. The U.S. Preventive Services Task Force also makes recommendations for medical providers about preventing skin cancer. The task force recommends that providers counsel fair skin patients aged 10 to 24 on minimizing their exposure to UV. Last year, Acting Surgeon General Boris Lushniak issued a call to action to prevent skin cancer on July 29th. CDC worked closely with the Office of the Surgeon General to develop that document. Based on the current evidence, the Surgeon General outlined 5 broad, overarching goals to help prevent future cases of skin cancer. The first goal aims to increase opportunities for sun protection while outdoors in settings like outdoor recreational areas and schools. The second goal addresses communication and the need to identify and disseminate effective prevention messages. The third goal relates to policies across all levels, from federal to state and local, and it includes organizational policies as well as legislative. For example, my own child's school does not allow her to carry sunscreen in her backpack. She needs to register it with the nurse and go to the clinic to have it applied. Allowing kids to carry and apply their own sunscreen would really help with skin cancer prevention. The fourth goal relates to reducing harms from indoor tanning by enforcing current regulations and considering new ones. And the fifth goal relates to strengthening our research and increasing our understanding of how best to prevent skin cancer in the future. So there are a few strategies within those broad goals that can really be effective and that we can work on. We can help incorporate sun safety education and policies in schools. We can support shade planting and land use development so that when new constructions are being built, we're remembering to make sure that there's adequate shade in outdoor spaces. We can help protect outdoor workers from overexposure to UV. Providers can counsel patients according to the USPSTF guidelines that I mentioned before, and can help by reporting their cases of melanoma to the State Cancer Registry. And we can enforce our existing indoor tanning laws. We've also seen some other positive results after the publication of the call to action. Miami Beach and Boston have made sunscreen available in some of their city parks, and the Minnesota State Fair and some sports stadiums are doing the same thing. The town of Montclair, New Jersey, has decided to become the sun smartest town in America, and they are working toward implementing all the strategies from the Surgeon General's call to action. In conclusion, everybody has a role to play when it comes to preventing skin cancer. People can use proper sun protection while outdoors, and remember to avoid sunbathing and indoor tanning. Schools can allow students to use sun protection while on school property, encouraging them to wear wide-brimmed hats and apply their own sunscreen. Communities can increase shade in outdoor areas. Also, be aware that all those with lighter skin are at highest risk. Anyone with skin can get skin cancer. Be aware of your skin and report any unusual changes to your medical provider.